My name is Jacob Gonzalez, and I am one of the program coordinators of our technology assistance program at Search and Care. But first things first, just a little reintroduction about who is Search and Care, who we are as an organization. We're a 50-plus-year-old nonprofit agency dedicated to helping older adults live independently in their local communities through our case management, socialization, and educational groups and programming. And all of our services are free. One of the programs that we're a part of today is the program that I coordinate. It's Silver Circles. We are a technology-based assistance program. I always say our main bread and butter is one-on-one help. We also provide group workshops, but we always know that there may be moments in either a virtual world or in person where you may be a little bit hesitant to ask some questions, just because we know that it can be a little bit of a daunting feeling when you have a question when someone's explained something possibly already twice, and then you feel as if you don't want to hold the group back, or maybe there's some shyness involved there. So we really emphasize one-on-one assistance. We have plenty of volunteers, many that we've just onboarded from Pace University, actually. So they're able to assist you either at your home, at our office, even remotely. Please keep in mind, once again, that our organization is only serving those that are 60 and over. We are talking about part 2 of our MyChart training series today. This topic, it's basically going to be about general use on MyChart, because last session we talked about signing into MyChart, how to get set up, things of that nature. I gave a little preview at the end of some of the main features that we can utilize. So today, the main goal is to find where those features are and what those features include and how to use them in your day-to-day. The way we're going to learn some of these features today is going to be understanding particular icons. There's going to be many icons that you see on MyChart, even on other telehealth apps like Northwell Health, Follow My Health, other particular apps that you may have from a doctor's portal or things of that nature. They usually share the same types of icons. So we're going to try to learn those today to see how it'll help you navigate through certain features. And once again, we'll be going over looking at future and past appointments, checking your test results, checking prescriptions, and then also messaging your doctor. There's going to be many things here that we're going to have to leave for the third module in terms of step-by-step instruction, but we want to mainly show you where to find these features today. That's going to be the main goal. What are icons? An icon is an image on your device's screen that represents an application or an action, like sending a message or checking your appointments. So understanding what certain icons represent will be very important while navigating through MyChart. These are going to be icons that we see on devices, whether it's on your phone, your computer, your tablet, whatever it is. It's going to look pretty similar. When I show you an icon and then you see it, you're like, oh, that means this. I know what this means, so I know where to go from there, right? So I always say understanding icons is a very important thing to grasp. Let's start first with just going back to what we talked about last session. Once you signed up for MyChart, this is going to be your homepage, and this is where you're going to have access to 4 main features about MyChart. I'm just going to zoom it in a little bit, and as we can see, there's actually 5 arrows here, but there's actually 4 that I really want to emphasize right now. So it's the visits, the messages, the test results, and medications. We're going to be talking about that today, but if you see on the far left, there's an image with 3 lines. So let's check what that does. This is actually called the MyChart side menu, or that's what we call it actually. It gives you a list of all the possible features of MyChart. There's many features here that are not even advertised, I would say, that you have to really dig through to find these features. But the main reason why we show this is that this is going to be a great way of navigating through MyChart. If you ever are trying to figure out where all the features are located, the side menu is a great option. So once again, that's going to be by clicking the 3 horizontal lines on the left of the screen. And I always like to call that icon the hamburger icon. And that's actually what it's really called in real life too when it first was created, because you can imagine the top line is a little bun, the middle is a patty, and the bottom's another bun. That's one way of remembering that. And just keep in mind, this type of icon appears in multiple areas, not just MyChart. And that always means it's going to provide you with more options. For this example, once again, it's going to take us to the side menu. On the left, there is that side menu, but as you can see, there's some green arrows pointing out to the main features that we're going to be talking about today. That is a calendar, and that is going to be the way you view your appointments. This is going to allow you to view both your upcoming and past appointments. This is a very important feature, one, for keeping track of where your appointments are happening, but even the past appointments, and I'll explain that in a moment. But first, for viewing upcoming appointments here, I have a couple of arrows with some numbers inside. So we're going to go in number order, starting with number 1. We're looking right now at upcoming visits. What we see right here is that for this example, example, this appointment that's happening on June 11th is going to be a telehealth appointment. So that means it's going to be something over either video or a phone call. Most likely a video for this example. That's number one. It lets you know the type of appointment, the start time, and how long it should actually last you. So it says here it's going to start at 9:20 a.m. and in parentheses it says 20 minutes. So that's how long the appointment should last. Number two, it mentions the date of the appointment along with the day itself. So for this example, once again, it's June 11th. That's going to be on a Tuesday. Below that, number three, there's going to be an option to either reschedule the appointment or cancel it. Because I know there's some times, even for myself, where I'm accidentally overbooking something and I need to reschedule. So that's a perfect opportunity for you. Moving to the right, number four mentions preparing for your visit. So that's that little green button right there. And that's actually what we're going to be continuing from in the next slide. So here we go. Once we click on that prepare for your visit button, you'll now be shown this screen. So with some appointment details. And then this is mainly what you're going to find for only telehealth appointments. For in-person appointments, it's going to look not so much like this. So let's break this down. For number one, there's a blue button that says prepare for your visit. This is something that you can do before your appointment, where it's essentially checking in or just filling out some necessary documentation before your appointment. When you go to the doctor's office, they usually give you the clipboard and the pen and it's time to sign some things and things of that nature. That's where we can actually click on prepare your visit, where you're able to fill out those documents before actually seeing your doctor. So it should save you some time there. Number two is a confirmation button. What this means is that if you were not to click it, you just left it the way it was, you may get a call from hospital staff just to remind you of your upcoming appointment and just to make sure that you're all set up and prepared for your appointment. So if you were to click on that, you would not receive a reminder because it says here right underneath that button, let staff know you don't need a reminder call. So if we confirm that, no call is going to come to you. Number three on the left is going into a little bit more details about the type of appointment. Once again, it's telling you the doctor's name, the fact that it's a video visit. Once again, it's giving you the day and the date itself, Tuesday, June 11th, along with the time. It gives you another opportunity to reschedule or cancel your appointment. To the right of that, number five, you should see visiting instructions. This is just letting you know some of the basics regarding your telehealth appointment or your video visit, just letting you know that your doctor will be seeing you at your scheduled visit time, and just to click on the email that you received titled appointments. And they also leave like a little hotline number. So just in case you need any additional assistance, that number should be able to help you out. So now we've talked about looking at upcoming appointments. Now we're going to see past appointments. This is very important to me because I know there's moments where I want to look back at what happened with my previous appointments, especially if there was something there that I just needed a reminder about. We're going to go through this one by one. Number one, this lets you know how far along your previous appointment was. I've actually worked with some clients and we were working on some of these, looking at past visits, and it was able to keep a record of at least 10 years worth of appointments. The details may be a bit scarce in terms of those that were maybe 10 years back, but it's still there. So I would highly suggest if you ever have your MyChart account, if you've been with the same hospital for years, check to see if there may be some of your past appointments that you can scroll through. It may be just an interesting test just to make sure things are working. So it lets you know that it's been a year since this last appointment. And number two is mentioning the type of appointment. So for this one, it was a special pathogen immunization, and that took place on November 7th, 2022. It also lets you know the nurse's name and the facility that you took that appointment at. So here is the more important portion of it. For number three, there's a big thing here about notes. I actually mentions here view after visit summary and view notes. If you've ever been to a doctor's appointment, especially, let's say as an example, a primary care appointment, just like a regular annual physical, whenever you get a sheet of your basic information, your medical information, so like your weight, your height, your blood pressure, things of that nature, before you actually see the doctor, that's going to be in your after visit summary. Any of those logistics that are involved before you see the doctor in terms of your health, it's going to be put there. But then when you're with the doctor, when he actually sees you and he's talking to you, he's looking at you one way, but then you see him tilted to the side typing away as he's talking to you, that's going to be in your view notes section. Let's say you've mentioned that you're looking into any medications, or you've been mentioning that you may be suffering from anxiety or depression or something along those lines. The doctor will take note of that just so that you're aware and that you have proof that you've mentioned it to your doctor. I always say this is very important information. I'll give you an example for myself. I've had shingles in the past, 2 years ago now, and if I ever wanted to go back and see what the doctor was describing as that rash that I was developing, it would be a good time to go back and just view those notes if I'm ever developing a similar type of rash again, just to see, oh, wait, there may be a correlation here. So I'm just saying it may not seem that beneficial, but it can be if you have any chronic issues or anything of that nature that you may just want to refer back to. So just highly suggesting looking back at your past appointments if you're able to. So this is going to be for messages. You may see it's mainly going to be the envelope icon that you're going to see throughout MyChart, but there may be some other times where you see that little speech bubble with the 3 dots. So just in case, we added both there, but just keep this in mind. This is for messaging. This allows you to message your medical provider for non-emergency questions and concerns. Non-emergency. We're going to give you some examples of that. We're actually going to be getting into more details on the 3rd module because there is a bit more steps involved here, but we're going to show you the first image. Whenever you press that message button, the image on the left is what you're first going to see, and then the image on the right is what's going to be shown when you're actually composing the message. So let's go back to the left side where it actually gives you a couple of options. It says, do you want to refill your medication? If you want to look for an urgent care, if you want to schedule an appointment, but we're looking at asking a medical question. They really want to emphasize that you have a simple medical question that doesn't require immediate response. They always set the expectation up that whenever you message your doctor to please allow 2 to 3 business days before actually receiving a response. Unfortunately, this ultimately depends on the type of doctor you have. My family has a doctor that's very responsive. You may have a doctor that may have more patience than anything. It's a bit slow for them to message back. So just setting up those expectations, because you wouldn't want to say, hey doc, I'm getting a really bad rash right now and it's growing by the minute. I wouldn't send a message for that because then you're going to have to possibly wait 2 business days for that. And who knows what that rash could develop into in the meantime. So going back to the right image here, this is what it's going to look like once you've gone through the process of creating that message. It sort of acts like a little email in a sense because there's a subject line. So on the top here, we're just going to look on the right. It's I have a question. Right below the subject line is the body. So just like an email, you're able to enter your message. And this person put down here, good morning. Just wanted to confirm you said I should not eat anything after midnight, correct? That's not an emergency because it doesn't seem like this person has to eat something by midnight. She's just curious to see what's going on or if this is something that should be of concern. Once again, not something that's immediate. So these are just things that even if you just want to check in with your doctor after you had a session with them or an appointment, oh, hey doctor, can you just remind me, what did you tell me about that particular topic that we talked about? Or is there someone that you can refer me to after our discussion about needing a heart doctor or something along those lines? That's something you can do. And I've done that myself where you can actually ask for a referral in a message. So that may be a possibility, not all the time, but it could be a possibility. So something to keep in mind. Just keep in mind that you actually can add attachments to your message. Let's say there's like a minor cut, took a little fall and you're just checking in to see, hey doctor, here's an image of a cut that I have. Is this something that should I make an appointment for or what? Something that's tiny, like maybe like a little scrape or something, things of that nature. Once again, is not a major injury that you have when you're sending that message over. Here's another example of messaging your doctor. We're going to start from number 1. And on the left side of this shot, you can actually see that it mentions the facility of the patient. This patient's at Mount Sinai Health System. They're actually speaking with a nurse practitioner from Mount Sinai. Number 2 mentions the nurse practitioner's name along with the date and time of that message. So just keep in mind, this is something to utilize just in case you're trying to get in touch with your doctor. Even it says right here below, it's hard to see, but in small font, it says, please allow up to 3 business days for a reply. But let's say 4 days pass, 4 business days pass, and you can actually refer back to your message because you have the date and the time that you posted your question to the doctor. So that's something just to keep in mind, that you have that information that you can utilize for yourself. If there may be an issue that arises that, hey, I've been trying to get in touch with you. It's been 4 days and it says to allow for 3 business days. What's going on? And taking things from there. As much as we can learn about MyChart, it's ultimately up to the hospitals and the facilities to follow up with us. So that's the one thing just to keep in mind. But going back to the example here, so once again, you can keep track of your date and your time. For this example, the patient has a pacemaker. They're trying to figure out the remaining battery life. And this is something that's not urgent. You'll see in the response momentarily. It says, hello, your pacemaker home monitoring report is stable. The device is working normally, and there are 9 years remaining on the battery. We'll check in again on 9/15/23. Thank you. So once again, something that's not urgent, because if there is 9 years remaining on that pacemaker, I think this patient's going to be fine in terms of waiting a couple of days for a response. So those are just some things to keep in mind. And number 3 is the patient's response. I'm going to mention it again, how messaging your doctor or learning how to message your doctor actually saved one of our clients' lives where he had a heart problem. The doctor was trying to get in touch with him. It was an unknown number, so he didn't pick up, but he was actually able to see that a doctor messaged him on MyChart, and so they were able to follow up that way. And ultimately, the doctor was asking the patient to provide some blood pressure readings from his home kit. And once he did, it didn't seem right to the doctor. So he asked the patient to make an appointment. And when the patient went to the appointment, he ended up suffering from a heart attack. So God knows what could have happened before if he didn't go to the doctor, because it's a terrible situation to be in, but at least it happened while he had medical assistance literally right next to him. So just some things to keep in mind, how messaging your doctor or just keeping tabs on those types of messages can help you just to stay up to date on some of your test results or just general medical needs. So test results. So it's like a little beaker, like in school when you're doing those science projects. So whenever that's the case, it's going to be test results. That's blood tests, COVID tests, any type of test that you take at a hospital or a facility, it's going to be recorded here for you. We're going to be looking at the example of test results. Whenever we click on those test results buttons, so if we go to test results on the home page and then we go to this page here, we actually picked out a test result from a list of results here, just so we can take a look at this. This is from someone's annual physical when they're usually getting their blood test drawn. So this is for a CBC and differential, and it's okay if you do not know what that means. We're going to get into that in a moment. Number 2 is mentioning the type of test results that we're getting here, or the type of specific results. So on the left, it mentions WBC, which is white blood cells. So it's a white blood cell count, and then red blood cell count on the right. So just to keep this in mind, there's a little bit of a scale. For each result, there's a yellow, green, and then yellow line. One part is yellow, the middle is green, the other portion is yellow. So what this means is if your result is further on the left, that is on the lower side, the range of where you should be. It's on the lower side. So it ends up being yellow and on the left, low. And the exact opposite's the same. If it ends up being on the right and yellow, it is on the higher end. It does mention under WBC, the normal range that you should be at for your test results to be stable. This person on the left, that number 7, that person's pretty much right on the middle. As you can see, it's slightly leaning toward the left, but that means they're in a good place. If you see on the bottom right, like the middle right test result, HCT, you can see that number 37, it's in the green, but it's leaning more toward the left. So what that means is that you're still stable, but you're more on the lower end of where you should be. We're still in a good spot once again, but you're like on the border of becoming on the lower end. And if you look to the left of that, where number 3 is located, or it's pointing to for HGB, this person's on the higher end. So it's on the far right side, and that number 18, it's leaning all the way to the right. So that person is super high in terms of their result. But if you look below that for MCV, the person's all the way on the left for that number 50. They're on the very low end, unfortunately. So those are just some things to keep in mind in terms of how to read your test results. CBC and differential, what is that? For every time you have a test result, to the right, there's a little section. It's hard to read here, but it says, want more information about CBC and differential? Click here to learn more. If you were to click on that, you'll be sent to a page that will be able to describe or explain to you what the purpose of that test is and what they'll be reading off of that test. Just to keep that in mind, because I know I've had plenty of clients that mention to me, hey, Jacob, I know how to get these test results. The day of the test result, I'm getting a message on my phone saying that the results are ready, and I'm able to look at it, but you know what? I have no idea what I'm looking at. So once again, we can learn all there is about MyChart, but it's ultimately up to the hospital or facility to help us out there too with understanding what we're reading and things of that nature. Number 5 is just that there is an icon to the right of the screen, or it may look a bit different if you're using a phone, but there should be an icon somewhere on these test results screens to print out your results. If you ever need that for your own personal need, or if you need to send that to a family member or another medical provider, there is an option for that. It's not a blood test here, but we're doing a COVID test. So same idea. Once again, number 1 is mentioning the official name of this test. So it's the COVID-19 influenza A/B PCR. It's the PCR test. For number 2, it's letting you know the specific results. It's either going to be a positive or a negative result. And unfortunately for this patient, it's a positive result, which means, as you can see to the right of the word positive, it says abnormal. That just means that the person currently has the virus. Unfortunately, they have to take the necessary measures for that. But the good news is they can see the results from their home and not have to go to the clinic while they're positive for COVID. So potentially lowering the chance of spreading that around, especially if you're feeling sick. And if you were able to get like a COVID test or a flu test or anything like that, you're able to view those results. It's very beneficial because you can stay home nice and cozy while looking at those results. results while eating some soup. Number 3 is mentioning that if you're unsure what this test is about, you can click to view more information and it'll be able to explain that type of test for you. This section is going to be for viewing your medications. This is another important section here because we want to make sure which medications are on file so you can see what's on file for you and which pharmacy your medications are going to. A couple of things here. So we're just viewing the medication. It's going to give you a list of your current medications and which facility. For MyChart, you can connect multiple organizations together if they support MyChart. If you have Weill Cornell, Metropolitan Hospital, NYU Langone, they can all go together. They can all be matched into one screen for you. So if you have medications prescribed from each of those facilities, they would be listed for you individually over here. And they will definitely mention to you how it was prescribed and from which facility. Now let's break this down real quick. Number 1, for this patient, they have prescribed ibuprofen 100 milligram chewable tablets. So below ibuprofen, similar to the test results and things of that nature, it actually tells you the commonly known name of this medication, just like it would tell you the commonly known name for the type of test too. Same here. For this one, it's mentioning children's Motrin. There's also some medication instructions. It's obviously going to be a little bit more complex if we're having something other than ibuprofen. So for this example, it's just saying to chew 1 tablet, which is 100 milligrams total daily. It lets you know below there's 2 refills available before May 13th, 2025 for this patient. For number 2, it mentions some prescription details here. This is pretty important. It lets you know, once again, the date that the medication was prescribed, who approved the prescription medication. Also, in the middle here, it mentions the refill details. It mentions that you have a quantity of 30 tablets, which equals a 30-day supply. And to the right of that, it mentions the pharmacy details. Just keep in mind, you can have multiple pharmacies on file for you on MyChart, but that's why it's important to just double check which pharmacy it's going to. For this example, it's going to Lincoln Medical and Mental Health Center. It gives you the address along with the phone number. So if you ever have to give the folks a call, it's going to be on that listing as well. Number 3, it's a request refill button. But for that one, we're going to have to go into module 3 because there are more steps involved to actually get to request a refill. I just want to remind folks, we provide one-on-one assistance. Our office is located on East 94th Street in Manhattan between 2nd and 3rd Avenue. You can do an office visit. We can come to your home. We have a catchment area for home visits, so we'll have to discuss that if anything. And we can also do remote assistance as well. So if this is something that interests you, we can definitely help you out. And also for general technology assistance, we also assist with that too. So if you ever need help just with understanding social media, anything of that nature, please give us a call and we can take things from there.